Oh, there we go. I got the
All
invitation.
right. Now we're rocking and rolling.
Yes, we did it.
Like Dora, we did it. We did
We
it.
did it. Hooray. Okay, so happy to introduce myself. And for those of you who are not on the Zoom, just to let you know, we are live right now on Zoom, on YouTube, and Instagram. My name is Dr. Monica Blied. I am a clinical psychologist in Southern California. I specialize in aiding people who are living with chronic illnesses. I myself have been living with chronic illnesses for 13 years now. I also provide neuropsychological assessments for children and adults who suspect they might have ADHD or autism or learning differences. And so my path professionally has started with like learning about the brain and like how what's happening in our brain as far as our chemistry and our wiring affects our mood and what happens in our body. And especially after I was diagnosed with lupus during my second year of grad school, it became especially relevant and important for me to be able to figure out how to live well with chronic illness and not die. But then also to minimize the stress that is avoidable, minimize how the stress is affecting my body, because stress can cause flare-ups, which can impact every organ in my body, as all the lupus warriors who are watching are aware of.
Yes, and stress is a killer in itself, no matter if you have a chronic illness or anything that's going on. Everybody needs to know you can talk to somebody and you can make sure that you get it out. It's better to get it out. Look, they have rooms that you can destroy. I've done one before. It's great, and somebody else cleans it up. So with that, the topics we'll cover today is coping with flare, fatigue, and mental fog, finding identity after diagnosis, setting boundaries with grace, self-advocacy in medical settings, and somatic mindfulness tools for resilience. So just to share just a little bit, if you're new to my page, I am pretty sick lupus chick. I have lupus, but I'm in remission. And I've had lupus for about 15 years. My mother had lupus as well. So I can attest that coping with flare and fatigue and mental fog, there are days where I wake up that if I don't have coffee, my mental clarity is often, even when I do have coffee, it takes a little bit for my mind to start to go. I mean, what are some things, Dr. Monica, that you have experienced or some tools that you could give us?
Yeah, I think I'm trying to adjust the sound issue. So, as you mentioned, like waking up with like brain fog and chronic fatigue, I wanted to share with everyone like why that happens. So, in lupus, there are actually specific inflammatory cytokines that happen in our bodies and our brains, pro-inflammatory cytokines that cause changes in our brain chemistry. So lower serotonin and dopamine, and that can cause mood changes, irritability, and anxiety and depression. That's what causes the cognitive dysfunction. So the brain fog and the fuzziness, the cloudiness, it causes forgetfulness and the fatigue that we all experience. And so I think that sometimes when those things happen, sometimes, especially if you're, you know what I was going to say, if you're new to the diagnosis, but even if you've been living with it for 13 and 15 years, there can be some self-shaming and like, oh, I need to like get past this and work through. And just realize that like it's not an issue of willpower. We're talking about biology. And so, yeah,
Yeah.
we'll talk today, and I'll share some things that we can do to try to help. But as you're doing these strategies, also the number one strategy. Oh my gosh, I love the filter on Instagram. You look so pretty. I mean, you're pretty anyway, but like, dang girl, I need a filter too. ADHD can get in. As you're doing these strategies and practicing these skills, the number one is to give yourself an abundance of grace. Shower yourself with kindness and know that, like, sometimes these skills will work and sometimes you just need to take a nap.
Yeah,
Okay.
it's
Yeah.
okay to, I
Yeah.
mean, I know it's probably not ideal when you are at work to go in the corner, but utilize those times that you can walk away from your desk. I know that it's different for me because I work from home a lot, but for people who work at a cubicle or they have a place that they have to show face for work, oftentimes we try to go to the break room and then that's not our safe space. Go to your car. Okay, go to your car and make sure you are very adamant about the fact that you make a safe space for yourself. I remember when I did work in an office and I would go into my car because if I sat in that lunchroom, everybody wanted to talk. And I'm like, dude, I only got 15 minutes. Please leave me alone.
Yes. Exactly. And also take your breaks.
Yes.
Do not feel kind of one way or another because the work culture or the environment is like, oh, we got to get this done or this deadline, and I'll sleep when I'm dead. Like, no, like, let's try to stave off, like, let's try to stave off death and sustain life, by taking those breaks. And I love, Shamekka, how you said, like, I will take my break in my car. Like, I have clients who do work full time and they do their therapy in their car while they're at work, during their lunch break or something. And so therapy is one of those, strategies that can help with mind body health. In
Mhm.
addition to, you and I were talking yesterday about how you do meditations and breath work, and we'll talk a little bit later, but maybe I'll bring it up right now about somatic therapy. Somatic basically means like body based. And so, especially since lupus and other chronic illnesses impact our bodies, we can do stress management strategies that also interface with our bodies. And so, the very simple one is a self hug. And so, I need to back up a little bit for the Instagram people. But what I'd like you to do is just put your arms on your shoulders
Hmm.
and rub from your shoulders down to your elbows. And then back, shoulders to elbows. Okay, I need to stand up a little bit, but not too much because I'm wearing some,
We used to do this as a child and we would pretend that we were making out and be in the corner like this. Like,
Right, right. But there's actually a science behind this. This is called havening touch. It's a somatic
oh,
therapy, and it releases oxytocin in our bodies. This is the love hormone. It releases in our bodies, and it's just, I mean, it feels good to me. And when's the last time that you just gave yourself a hug? That's part of that
but
kindness.
yes, I get it. I get it.
Yeah. Let me just do one more because it's feeling good right now. Another one is self massage. And so I
Okay.
always like to start with my neck because that's usually where I hold my tension, my
Mhm.
neck and my shoulders.
I thought you were going to say back, my neck and my back and oh, okay. This is PG, my bad. Okay, let's go.
My neck, my back. Okay. Okay, we're
Oh,
not gonna
my bad.
finish that, but you know. And then so this is another one, and I know we're just going through these really quickly. Oh my gosh, this feels so good. Anytime I teach these to my clients, I'm like, this is more for me than for you, but I'm glad you're benefiting from this. But then another one is the cradle.
The cradle.
Yes.
Almost like you said, the crane, like, okay, the cradle. Okay.
Yeah. And so just cradling your face.
Mhm. This is
And
what I tend to do when I listen to people. It's just like a natural reaction, but
yeah,
now we know the science behind it.
yes. And what does this feel like? What does this remind you of, Shamekka?
Wonderment and thinking.
Yeah. Yeah.
Mhm.
And then also maybe like if you had a nurturing parent, then they might hold your face like this. You know what you say?
I didn't.
Okay, yeah. Or if you didn't, then reparenting yourself.
Yes. I was like, low key, I didn't.
Yeah, reparenting yourself. reparenting that inner child, taking care and holding. And that's just a few of the things. Some people just like massage and rub their hands.
Mhm.
And when we
Very
do,
my
yeah,
hands.
one and then the other, that bilateral. So
Mhm.
one side of the body, then the other, like that actually also activates our vagus nerve, which is part of our,
Vagus nerve, is that our
yeah.
gambling hand, our gambling nerve? Like,
Uh, uh, uh. Girl, I didn't even think about that, but it's
I
VA.
be on it. Okay. I'm all over the words. I have my car. It's going.
Yes, I didn't even think about that, but yeah, it's
You
actually, so
can
it's
use
a
that.
cranial
Okay.
nerve, and
Pay
it's
me for that. Okay. Vegas. Yeah.
right, Vegas, the other Vegas, VAGUS, but it starts here,
Okay.
the base of our brain, and then wanders. Vegas is Latin for wandering, and it wanders down across all of our organs. And so when the vagus nerve is doing what it needs to do, when it's more loosened, our organs can work like they need to. Our stomach can do its digestion work. Our heart can pump at a regular rhythm. And so just doing a bilateral self massage or
Mhm.
bilateral, here, little, bilateral tapping, that's going to engage,
Yeah.
activate, but engage the vagus nerve and help our bodies, our nervous systems to calm down. No matter what's going on around us, we can control what's happening within our bodies to calm down and relax.
Yes. And if you ever feel that anxiousness, a lot of people that I speak to that have chronic illness always feel anxious. Now, sometimes a little bit of mix of the drugs, that is a part of it, but it's also just the feeling of, am I doing enough? Am I letting people know I'm hurting? Is this happening? Does anybody understand that I'm screaming out loud? That I'm not really screaming, but I'm screaming out loud, like, help me. There's just so many things that our minds are racing. And if somebody tells you that they don't have those feelings, I don't know who they are. Like, God bless them. They must be a monk, something like that. But
Right.
most of us have a lot of anxiety that we're hiding.
And
I
so,
was gonna make if you actually, I can now hear it better when I turned off the sound on my laptop.
okay.
Record. So when I,
Right.
because I can still hear myself through the for your phone. Okay. Let's
Okay.
try.
Is that better?
Do you have it off your laptop?
Um, let's
If you
see.
turn the volume off, it'll still record. It's just the volume off, not the microphone.
Okay. How about that?
I can talk now.
Yes. Can
Yes,
you?
thank you. So
Yay! Okay. Sorry for that first 20 minutes.
Yes, you both sound better. No
we
echo
all have
anymore.
that. Yeah. So making sure that we covered two topics here. Now, the next thing is I want to talk about a lot of people struggle with once you get the diagnosis. The strongest factor in this whole journey is honestly figuring out what's wrong. Then number two is finding your identity after the diagnosis. And I think that for me, it really wasn't so much an identity because my upbringing instilled in me that this is the way it's going to be. I already had a preview. Before everything was happening, I had a preview of the movie and what to do, what not to do. Okay.
Yeah.
So for everybody else that didn't have a parent that had what you have or a similar struggle, it's trying to figure out and wonder like, oh my God, I'm going to mourn my past self. Now this is my new self, and I can't do all the things. And what I try to describe to people, because I know that I'm that 1%, is don't focus on what you can't do, focus on what you can do. If you stop focusing on what you can't do and focus on what you can do, things will be a lot easier. If you're always, I can't get in the pool now, I can't go in the sun now, I can't do this now, then you're already mentally starting that path of negativity in just putting yourself into that your own pity party. And then that doesn't go anywhere.
Yeah.
So that's what I try to tell people, and I always say, I'm like, are you a Mexican or a Mexican? It's from, I forget which movie it was, but it's real because basically what most people are always saying is, don't you wish you could do it? I'm like, well, I kind of get around that. And if I can't, like when my husband loves to go scuba diving, and I was like, honey, I can't breathe. I can't breathe right. So I found a place where they do underwater scooters, which people are like, oh my God, there's underwater scooters? Yes, I put it's a big thing over my head. And
Yep.
I'm literally, I was like, it's better than scuba diving. You're just coasting underwater underneath a boat and you're just like,
That's
throughout the
so
water and sea
cool.
turtles are going past you and little fish and you're just like in an aquarium and they're like, oh, and I said, yes, there's things that you can do. So what have you encountered?
Yes, the so similar. Our journeys are so similar. I wanted to point out that Miss Amanda Green on Instagram said the struggle is not knowing, and finding out was a relief. Yes, and it's funny the finding out, the finally getting the diagnosis. And this is true with chronic illness. This is also true with neurodivergence. When people find out for the first time, like, oh, I'm autistic or I have ADHD, like there's a relief followed by a grief
Yes.
of like, wow, I had all these years of not knowing. What could I have done differently if I had known? Right. And so just giving yourself grace and allowing yourself to go through that grieving process and just knowing that that is totally normal. And as you said, Shamekka, like getting out of that negative cycle, because what happens when you do have that negativity of like, oh my gosh, like I had the same, like I used to love hiking, but like, okay, obviously I can't be in the sun anymore because I tried it when like my labs were good. And so I thought I was cured, of lupus and it's not a thing anymore. And I went on a 2-hour hike with my oldest kids' Girl Scout group and it put me in a hospital, that much sun exposure. And so there's a grieving part, right? But what happens in our brain when we have that negativity is that our brains will stay on that loop and continue to look for what else is wrong. What else can I not do? And so you actually do have to be intentional about, like you said, Shamekka, well, what can I do? So I can go hiking before 10 a.m. and after 4 or 5. Like on my phone, I can look up the UV index. And when the UV index is like 3 or lower, ideally 2 or lower, I can have all the fun I need outside. So wear my sunblock, and I do have a recommendation for that. That's good for dark skin.
You put on your sunblock, people. I have hats.
Yes.
People see me out and they're like, you're out in the sun so much. And I said, do you see me without a hat? I always have a hat on. I have SPF 1000, spraying it 10 times. Okay. And all my other friends are lack of melanin. And so the struggle is always real.
Yes, exactly. So still wearing the sunblock, but UV is, the UV index that goes up to 11. I'm making sure that it's 3 or 2 or somewhere around there, wearing some protective clothes. So I can still do that, but one thing that has really, and, by the way, I really need that like underwater scooter, like connect, please. That sounds amazing.
Like nobody knows what it is, but when I show them, it was my entire family and you just see all the fish. It is not like AI or generated nothing. It was all the fish. And I am sitting there and I'm like, you see our faces look like we're kids that just got all the toys and Christmas and everybody's just in wonderment, like, oh my God. And it was in Hawaii. They do it in the Caribbean too. But they submerge you and it literally looks like a jet scooter.
Yeah, you don't even know how to swim.
Yes. And you're just jetting through and then you go to a place, they give you food and then all the little fish, it's like all the little Finding Nemos are right in front of you.
That sounds so amazing. So
yes, these are the things that you can do.
Yes.
And you know what? Like you said, hiking. My friends like to hike and I can try if it's a small one in the morning, early morning, before it gets really, really, really hot. But also, a lot of my friends like to, it's just 1 block. Oh, it's just 2 blocks. And I'm like, okay, that's what you say. My lungs say, try me and I will put you on the floor. So when we went to England for 24 hours, it was me and another couple and they wanted to take their time. And me and my husband hit all of the monuments within 10 hours. Like they were like, how did you see Big Ben? How did you see this? How did you see it? And I was like, I had a driver. And I told him, I'm not going. I said, can you take me to all these places, drop me off, take a picture? Woo, this is cute. Get
Yeah.
back in
And
the
then go.
car.
Yes.
Okay. That's how I roll. If I could have a
Yeah.
helicopter, yeah, drop me at that location. Okay. All right. If there's a way, there's a will, there's a way.
Yes.
I'll get up there. I was like, I'll
Finding
meet
a
you up
way.
there. I'm gonna be in that helicopter. I'm gonna drop down. I'm gonna take the picture, and then you can, climb up there and do all the things.
Yes, yes. So finding a way to still enjoy life, finding a way to still like treasure those moments. And I think that's the gift of chronic illness. That's the gift of mental illness, is that it gives you perspective on life of like, okay, these little nonsense things, it's not worth it. It's not worth my health. It's not worth me having a flare up of my, chronic illness. It's not worth me having, another episode of my mental illness. So, I wash my hands and I'm done. And that perspective is so rich. And I think that is actually, I strongly believe that that is what is going to help sustain us. That's what's actually going to give us more longevity, because we like figuratively kind of stop to smell the flowers,
Mm-hmm.
because we do have limits. So like for me, I used to love to travel, but travel is very hard on my body, like very, very hard. So I built in a day where like, okay, the first travel day and the second, I'm just going to be sleeping because my
Mm-hmm.
body has to recover from that travel. And so, like, I just travel with people. It's just my husband, but I just travel with people who understand. Like, I'm not going to be, you going like 10 spots, girl. Like, I'm like, okay, I'm going to sleep for 10 hours. And that's what I need. And then the following day, I can do something. So, each of us, learning your limits and honoring them, learning your own body, learning your own mind, what you need, and what are the spaces that will give you nourishment? What are the practices that will help to sustain you?
Right. And just it's all about the mind. And we'll go to mental focus. And what I try to tell people is your mind will quit before your body does. And
Mm-hmm.
that's because, you're already tapped out.
Mm-hmm.
But your body will respond to your brain. If you think about it and you're like, I can do it, I can do it. And when people say, no, 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 I was like, have you ever been in a workout, even before you were sick? And you're like, oh my God, I'm done, I'm tired. And then that song, Missy, comes on, and you're like, oh, okay. All of a sudden now you got a reserve, and you're like, okay, let me hit the treadmill. All right. And I'm
Yeah.
like, that's what it's like. Okay. Where you're just, oh, that song came on and that built me up. It was just because your mind was bringing you down. And you have to practice these things with your mind to get yourself out of this kind of depression. And it happens occasionally. Sometimes I get mad, like, I wish I could do all the things. And like you said, I go with a lot of my friends are very supportive, and a lot of them like just casually forget because we present
Mm-hmm.
to be okay.
It's
And
in
they're just like, it's hard for me to do this. And I remember one of my friends, when I went out with her on a trip, it was just a girls' trip this time. Usually it was somebody else. And she was like, you expect for me, and I know she didn't mean it when she was like, you expect for me to remember this when I am not used to being with someone who can't do all the things or walk as fast as I do. Because I kept saying, stop walking fast. Do you see that you're already at the stop sign and I'm all the way back here? You want me to remember for the next 3 days? It's hard. And I was like, yes, I do.
Mhm.
Yes, I do. And
Yes.
if you sign up with me and and you've supported me and you've sent me flowers and know that I'm sick, then yes, that's what I expect of you. And you sometimes have to set those, which leads into the next topic, those boundaries, and educate people because they don't know. I don't like, I'm not trying to make you feel bad, but I can't walk as fast as you. Now, there are some days where I don't know where I get this energy, and I'm like power walking like a mom through yes. And my kids are like,
Yeah.
mom, what's wrong? And I'm like, yeah. And then the next day I'm like, because
Mhm.
I feel it. Oh my God, I have so much energy. Yay,
Yes.
I have a good
Yes.
day. It's gone for a day.
Yes.
But you have to roll with that with me. And I explain that to them. They're supporting us and just reminding them. And then at the end, she got mad at the lady because I usually get on a wheelchair, especially if it's like one of those, if it's Atlanta Airport, if it's Orlando, who the heck can walk all that?
Right.
And the lady was like, you don't look handicapped to me. And by the end of the vacation, she wanted to rip that lady's head off. You don't know what this she goes through, blah, 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 blah. And I was just like, okay, don't get me thrown off the plane. I didn't even get on it yet. I mean, I'm appreciative of the
Thank you for
fact
your advocacy,
that
but
behind me, okay, that now but you got to stop asking me, like, if you think I did that one thing, don't think that I can do that thing again.
yes, yes. And someone commented, Sunshine, Asti said, and that's not asking too much. That's a minimum, and you're absolutely right, because we present a certain way, because our chronic illness is invisible. Similarly, a lot of mental illness is invisible. People forget, even, very well-intentioned people. So gently reminding them, like, no, I can't do that, or this is what I can do, or this is what I'm willing to do. And what boundaries are, they're our way of expressing love and maintaining a relationship that's fair and that feels good, where there's not going to be resentment, by saying, like, I am willing to do this, I am not willing to do that.
Yeah. And it's a lot of people don't want to say it because they feel like, I don't want this person to pity me. But how are you going to fight the battle if you're not going to participate in the war? Okay. You have to sign up and say something. And it's nothing. It's all about the way you present it. I have tons of people that do not know what lupus is, let alone the other 14 autoimmune conditions that I have. The reason why I don't even say all the other ones, because they'll be like, what is ILD? I'm like, interstitial lung disease. Okay, well, the fact that it has lung in it, that's the only reason why they actually get something from it. But all the other stuff, when I say, oh, I have Raynaud's, I have vasculitis, scleroderma, this. So when I just stick with lupus, even something as simple as that, even though there are so many celebrities that have it, they're like, well, I've heard of it, but what does that mean? And you have to educate people. If you don't even have lupus, if you just tell someone you have multiple sclerosis, which is quite common, people still don't know. Or if you say Parkinson's, like Michael J. Fox has made it very well known what that is, but we haven't made it very well known what it is, because there's variations. If you think about multiple sclerosis, there is Selma Blair and then Christina Applegate, and they're both two different things. But for us, it's like, okay, I can name people that have it and they all look great. There really isn't anybody, if I say Selena Gomez, but people forget, they talk about her weight up and down because of her being a celebrity. And they think, oh, she's on Ozempic, she's on this. No, dude, that's actually legitimately her illness. And I go up and down. Like right now, this time last year, I was 90 pounds. Now I'm like, I don't know what the heck happened. But it goes up and down. My medication hasn't changed, but there's a whole bunch of other factors behind it. It's not me, like, if anybody sits down with me, I eat like a bird.
Yeah.
Okay. But we have to give some grace. And then it's like, okay, well, Nick Cannon's fine. But then they'll throw in, oh, well, they have tons of money. And I was like, no money. I don't know if y'all realize there's no amount of money on this world that will keep you on this earth.
Yes. Even with the best medical care and those sorts of things, like that, it can be so unpredictable. And even with lupus and other chronic illnesses, there's variability, like you said, it looks different. And so not just educating your loved ones, the people that you care about, who you want to be in a relationship with, because some people just aren't worth the time, right? Just being honest. But the ones that you want to be in a relationship with, explaining to them how it impacts you. Because my lupus, Shamekka, is different from yours. Like how it affects me is different from how it affects
people
you.
Are the same. No two.
Yes.
And what do you experience? I'd like to let everybody know, because there's always, like, when I say something, it resonates with someone else. When you say something, you're like, oh, okay, yeah, that happens to me too.
Yeah. So for me, I'm never not in pain. And
That's
so if I ever complain, what's that?
I said that's the common theme when people hug me. They're like, well, you look like you were fine. I'm like, yeah, but I'm like super sensitive. So if you hug me too tight, my back hurts.
Yeah. So I'm never not in pain. There's always something that's hurting. Right now it's my lower back. It's, just different parts. Sometimes it's muscle, sometimes it's joints, and then also like really severe fatigue. I take medication just to be able to make it through my workday. And I'm very grateful and blessed to have a career where I can, earn an income and it's, more part-time hours. But not everybody has that opportunity. Not everybody has that opportunity to be able to take medication to keep them awake during the day,
Yeah.
because I can straight up sleep, have a 4-hour nap and then still sleep 10 hours tonight and still be
Honey,
tired.
right now I want to go to bed right now. Okay. At like every part of the day. Until it's late at night and I'm like, why am I awake?
Mm.
Why can't I go to sleep?
Yeah.
I'm a vampire. I must be a vampire. I'm part vampire.
I can feel that way too with like our sun sensitivity.
Yeah, that's basically it. But I'm a vampire, but then I'm a vampire that not wants blood. I'm always giving blood. Okay. It's
Right, exactly.
every week. I'm like,
Right,
here,
right.
take
How
my
many vials
blood.
can you take? Oh my God, I didn't tell you
Yes.
this is a good vein. I need you to use a butterfly needle because I bruise.
Oh, thank you. I mean, I don't know what it is. You just said the magic thing, butterfly needle. Okay. Butterfly needle. Now I just put it together. We are butterflies, right? So we only could take a butterfly needle because when I lived in New Jersey, I would always have to tell them, and they were like, oh, you have tiny veins. Oh, and they would try. And I'm like, if you stick me more than once, I'm gonna stick you. Can you please
Yeah.
just use a butterfly needle? But
Yes.
here in California, or at least where I'm at, or it must be in my chart, they know, don't mess with me. I know you can't do a butterfly when you're going to do an IV, but when you're going to draw blood, you better do a butterfly needle because my little hands, you see this wrist?
Yeah.
Okay. It's like,
Yeah.
I can't do all that.
I
So
understand.
it's kind of like the same thing where this rolls into self-advocacy. Don't sit there and let somebody torture you when you're giving blood.
Yes.
Don't do it. I know there's too many people that I'm like, oh, okay. And I used to do that too. And I'm like, they're gonna get it. They're gonna get it. And I'm like, nah, we're up to 6 and you're about to stick the needle in my toe as if I'm a crackhead. We're not doing this anymore. I'm going to say something.
Yeah.
You need to say something. And I encourage people to do so. How? You don't have to like come out of your skin, even though sometimes you want to, but self advocacy is key in your whole medical journey, whether it be with medical professionals, whether it be with family, anybody in your job. Like you said, we have the ability to work with flexible work accommodations. And a lot of people don't know that you can ask for that. It's still a thing in this day and age. It's a little shaky, but 13 years ago, when I asked my doctor, can you please write one? Because I think I saw in my company handbook that I could have a work accommodation. And that's when I stopped being out of the office. And he wrote a letter saying, this is what lupus is. He detailed it and said she needs to take naps, but she could still perform. And they said, okay, you can work from home. But people don't know, they're scared. So, what is self advocacy mean to you?
Yeah. It means what you described. It means speaking up for yourself. And that can be really difficult because those environments, especially medical environments, can be really intimidating. But sometimes you speak up for yourself and they still ignore you, they still dismiss you. And at some point, it can just be exhausting where you're dealing with so much in your mind, you're dealing with so much in your body, and you're just depleted. And so I wanted to bring up the fact that you don't have to go it alone. If you have a loved one that can come with you, who can kind of speak up for you, then do that. If you're able to write it down and say like, hey, you're refusing to give me this treatment that, I'm asking for, document in my chart that you refused and the reason. Go to the medical board, file a complaint, but then also there are people, patient advocates, who it is their job to show up. Oh, Shamekka's a patient advocate. It's their job to show up with you at your medical appointments where they can FaceTime in.
You call me and I'm on speakerphone.
Yes.
Well, at your doctor's appointment. And I interrupt and I'm like, excuse me, doctor, what did you say? Huh? No? Okay. Because when we're done, I'm going to check her my chart and make sure that the notes are appropriate. Don't be putting stuff in there. And there's how many people actually check their after summary visit notes?
After notes. Yeah.
None of them do, but I do. And I'm
I
like,
do.
that's not what we talk about. No,
Yeah.
you did not show me what this prescription meant. No, you just handed me the bottle. Don't put that. Don't let people do that. Pay
Yes.
attention, people. You guys pay attention to the bill when it comes. Oh no, I didn't know. I
Yeah.
didn't get no
Pay
salad.
attention to your
No, 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 no,
charts.
no. Do it yourself because that is your receipt. Treat
Yes.
it like it is your business. It is your money because at the end of the day, what pays their salary? Your money.
Yes. Yes.
Whether it be a direct pay or insurance, you are still paying for that service. So checking your charts regularly and making that be a thing, knowing that you don't have to go it alone. You can hire someone like Shamekka, or you can, get on my website, drblied.com/resources. There's a whole list of patient advocate directories where they take your insurance. Again, they can call in or FaceTime in, and you don't have to do it alone, but you deserve good care. You deserve to be listened to. You deserve to be respected when it comes to your medical and your mental health, period. I wanted to
Yes.
share a comment. Miss Amanda Green commented, rolling veins and lupus, only a butterfly needle works. And she just went to DC to advocate for the community. She's going to advocate in the lab. Awesome. Awesome. Thank you so much.
I mean, there's never enough. The more that we are loud about it, even though that we have celebrities that have come out about it, they don't talk about it too much. They don't talk about it the way that we need to talk about it. Everybody needs to collectively do it. Everyone has a platform. And they always ask me, if you follow what I do, I'm like basically never home. And I'm out shouting from the rooftops about patient advocacy. You need to hear us. If it's going to be for us, not without us. And I say that to the policymakers. You don't have to go to that level. You can just start by first self-advocating for yourself and then taking it to the next level of, okay, you being a part of a support group, that's spreading advocacy. You helping out in educating your partner and her family, that's advocacy. The more people know, the more that there'll be understanding and awareness around it to make things to change. I can tell you as a girl that witnessed her mother in the 90s go through what she went through to where we are today. We still have far to go, but we've come a long way. And the fact that, when people used to, and it's weird, I don't know if everybody has ever heard this, they used to think my mom had AIDS because nobody knew what the heck lupus was in the early 90s. And they'd be like, well, I heard it's an autoimmune disease. So does your mom have like AIDS? And I said, did I say AIDS? No, I said lupus. Oh, well, does that mean I could catch it? Absolutely not. Okay, this is the misunderstanding. And even like to this day where certain things I post and I put a hashtag lupus, have you ever gotten that little spam thing that says my doctor cured
Yes,
my
my doctor cured my herpes. Like,
okay,
what?
like, why did you put that? Like, why are you
Right,
trying to make this
right,
bad?
right.
So it's still a lot of misinformation, and you can help dispel that by just talking about it. And I know that there are a lot of people that still are very, very vulnerable and don't want to share. And if you don't have to be like on a megaphone like you and I are, okay? Like, yes, this is lupus, hear us. But you could just let your loved ones know, and it will still help. And I see there is a comment diagnosed in the 80s and I won't stop advocating. I love it. And that is completely it. And I'm sure that this resonates with you that, it's not going to go away, even though when I say they're like remission, I don't know, lupus can go in remission. And I was like, it's literally, I don't want to say it's like cancer because I don't want to take away from like lupus is serious too. But when they don't know that it can go into remission, it can come back. Just like lupus, it can come back. Breast cancer, colorectal cancer in itself. I'm like, oh, okay, I've been good for 5 years. And you still got to get your labs checked. And oh crap, this came back. Don't think that I'm cured because they're like, oh, why are you still having issues? I said I was in remission. I didn't say it didn't not destroy my body for the past 15
Right,
years.
right.
And help people understand that. They're just like, well, you already got a kidney, so what's the problem? Dude, did you know I had like 50 things wrong? That took off one.
And it's like multi-organ, right?
Yes.
Right.
I was like, my
Yes.
heart and my lungs are still trying to recuperate. Okay.
Yes, yes. And I see we have about 10 minutes left. I know
Yes.
we wanted to talk about some of the like mindfulness and more somatic tools. But you mentioned earlier in the conversation, Shamekka, about kind of just like having a lot of thoughts, like a lot of anxiety. And I wanted to
Um,
talk about that. Can you share what you do to manage stinking thinking?
so what I do, and of course, I know I'm like on steroids, literally, when it comes to the things that I do. But even for people that do a little bit, I know you might have racing thoughts, but what works for me, especially when I'm working or even when I'm frustrated, every time I need to have something block out the thoughts. The only time that I'm really not thinking is when I'm in the hospital and they medicate me and I'm like, I do not want to know my name. And they complete that. They had one job and they do it. Now we can't be in the hospital all day. We don't want to. But I put on headphones and I have music or I have the sound of waves, which in a perfect world, I'll have a beach house one day and be by the waves and I can just listen to that. But when I'm trying to focus and be like, okay, 50 tabs are open, I need to focus on one. I have some white noise and contrary to what people think, like more noise, don't you think that that messes you up? And I'm like, no, unless I'm lost and I'm like, let's turn down the volume because I can't
Right.
find where I'm going.
Gotta
Like
see the
that's the only
address.
time I'm like, turn this down. I can't
Yeah.
hear where I need to be.
Yes.
But it just that helps me. I'm not sure it helps other people, but that's like the most immediate thing because we always have our phones. And I just put on some music, or if I'm in my room, I put on the news or just
Yes.
Pandora and let it go.
Yes.
But what are some other techniques if you do not have those things? You're like in the forest and you have no signal.
Yes. Yeah. Well, I mean, what a beautiful and perfect example. If you're in the forest, notice the trees. Notice the leaves. Notice how they sway with the wind. Notice the little insects and the birds and how they just don't have any cares. And so, in addition to listening to music, like I love listening to music as well, which is like just to refocus your mind on something else. You can also be really intentional about, okay, in this moment right now, my feet are planted on the ground. Actually, my feet are underneath me because I'm trying to be a little bit taller for both of the cameras, but like my feet are planted on the ground. If you can get your feet in soil, that
Right.
actually it helps your gut microbiome, the different bacteria that will
It's a
move up from the soil.
grounding,
So
right?
good for you. Grounding, yes, like literally grounding. Helps your
Mhm.
gut microbiome, and most of our immune system is housed in the gut. Serotonin and dopamine, which are brain chemicals that help our mood, are also produced in the gut. So just getting your feet in soil is huge. But noticing like, okay, I'm standing here. What am I seeing right now? Different colors, textures, shapes, just noticing them as if you're seeing them for the very first time, getting back that childlike wonder. What am I feeling right now? Feeling inside of me, whether it be like a racing heart that I'm feeling, or maybe some tension somewhere. What am I feeling like the fabric of my clothes? What am I smelling right now? Just taking in all five senses. And what that does, that grounding, it gives you some space, some distance from an internal experience of emotional pain. It's used a lot in PTSD and trauma treatment. That's a huge one. And also just redirecting your thoughts. Like, okay, I realize that sometimes it's just going to be like a little bit of a chatterbox, in my mind, but I'm going to treat it like the little ticker tape at the bottom of a news screen. And it's
Mhm.
just there, but I'm not going to let it take up the most space living rent free in my mind. What's going to be the main presenter is, what can I do today that is in my control? So much of
Yes.
our anxiety is about, worry about the things that aren't in our control that we can do nothing about. Or
Mhm.
depression is thinking back on the past and our regrets and what we shoulda, coulda, woulda done differently. Let's be in this moment. What can I do today that's going to bring me joy, that is within my control, and letting go of the rest? And I know I'm saying it like freely, like it's so easy. It's not easy. It is not easy at all. It takes a daily deliberate practice, but you
Yes.
absolutely can do it. You can
We
do
have
it.
to be deliberate about our thoughts. And I try to tell people that it is a skill. Every time that I am speaking, for the most part, not speaking on stage, but just speaking for the most part with most people, I'm very intentional about my thoughts. It's a little bit mix of I don't want to have brain fog and sound like I have special needs. So it's most of the time like make sure you sound right, make sure there is a
Yes.
funnel that comes
No
down. But
offense to the special needs community.
yes, no, it's like I want to make sure that people understand that. But when I do things and I see people go in one room and then they start focusing on that, and I'm like, that's not what you went in there for. I am strategically like, I do this to this to this to this. And my husband is always like, why are you like that? And I said, I have to be very intentional about what I'm doing. And if I deviate from that, then that just will mess up everything. And I don't want to overload myself and be like, crap, I forgot to do this. No, I'm going to go into this room, pick up this piece of paper, then come back. And I know that it seems like it seems very elementary, but that's honestly what we have to go back to. And sometimes we forget, like you said, being like a kid, being intentional, being outside. We sometimes get so into adulting and it's depressing. I don't know why we wanted to grow up so fast, but take yourself back to elementary way of thinking that you have to be intentional about this. When your teacher said, don't go over there because you were supposed to go over here, well, do that in your head.
Yes.
And sometimes just write it down, offload, you know? And so for some of my clients, I prescribe worry journaling. So I want you to take 1 hour a day. And that is the circumscribed time when you can worry and write everything down that's on your mind that you're thinking about, that you concern, that you have to do, your to-do list, write it all down. And outside of that, we're going to do something called thought stopping. When those thoughts go back to, oh, what about this? Nope. Or, imagine a stop sign and redirect your thoughts to something else. Yep, you can do like this. Nope.
Block it.
So Wakanda forever. But no, so writing it down, offloading it so your brain sees, okay, I don't need to hold and juggle all this because it's in a place. It's safe. Sunshine
It's parked
asked.
right there.
Exactly. It's parked right
Yeah.
there. And that's where we're going to keep it. Sunshine asked if there are any in-person meetups. I'd like to connect and keep building community. I know through Lupus LA, there are groups that meet in person, and you can go to their website to look up. Looms for Lupus was the first support group that I went
Yeah.
to that
And
was
they
in
also do
person.
Spanish language, Looms for
Yes.
Lupus. And I am a
Yes.
part of Lupus of Northern California. We do not have any in person at this time, but I am working on that. So just find if wherever you are, I don't know where you are, but look for local chapters. You can go on the LFA website and it can tell you what, once you put in your zip code, what chapters are closest to you.
Yeah, and that is LFA is Lupus Foundation of America, or you can do lupusla.org. There's a lot of support around. How do we want to close out? We have 2 minutes. How do we want to close out, Shamekka?
How do we want to close out, people? Well, it's been a mental health and lupus awareness month, and I think we should close out with just deep breathing, take the stress away. It is hump day. It is Wednesday. We are grateful for the day. We are grateful to be above ground. There are those that did not make it today. Let's rejoice and be grateful for that because that is something that we don't really think about. And let your mind and worries just go away for the next couple of seconds and just take a moment. And nobody ever takes a moment. They usually do when you're like, oh my God.
Yep.
Let's not wait for that oh my God moment. Let's right now be
Do it
grateful
right now.
for the day.
Let me teach you all something. It's EFT, emotional freedom technique tapping. So usually it's like through several different meridian energy points to tap, and it's connecting heart and mind. Like, okay, I actually believe this, but we're just going to do it right here on the collarbone. So 2 fingers on each hand if you have access to that, and you're just going to tap on your collarbone what you want to be true. I am grateful. I am grateful. Everything is not perfect. There are some things that I need to take care of, but I am grateful. I can handle this moment. I am alive. Taking deep breaths. With your eyes closed or open, in through your nose and out through your mouth. And today, repeating out loud with me, today, I will find reasons to smile. One more time.
Reasons to smile. That indeed is true.
One more time. Today, I will find reasons to smile.
I will find reasons to smile.
And you have access to this anytime.
Yes. Thank you, everyone. I hope this has been very, very informative. And if there's anything you have, both of our socials, please look out for all upcoming material for this video to be put on both of our pages. It's also available on YouTube. And thank you so much. Have a great rest of your day.
Thank you. Thank you for tuning in. Thank you, Danielle. Thank you, Adela.
Thank you. Y'all are the best. Have a great day. Bye.
Bye.
Amanda Green. Bye.